So this young lady today presents for a total nail avulsion. She suffers from chronic ingrowing nails to bilateral corners here. So one of the options that we do here in the office is to have the whole nail removed. As you can see, her nail is quite thick, and that is one of the reasons why she's subjected to ingrowing nails. And with this procedure, what it does is that it gives patients up to a year relief while the nail is growing out. So this is a viable option for those that are suffering from chronic ingrowing nails. So what I'm doing here is I'm just lifting the skin of the nail fold, the proximal nail fold, and the lateral and medial from the nail plate, just to make it easier for me to remove the nail. And then what I do next is I go underneath the nail plate, just above the nail bed. As you can see, I'm weaving in and out with a free elevator, and what I'm doing is I'm slowly separating the nail from the underlying nail bed. And depending on how thick the nail is, it can be a little bit tough, as you can see. So what I do is I go all the way until it gives, and I've reached the nail root then. So I release the central aspect of the nail plate, and I'm going along the medial corners, getting my freer elevator underneath there, just to make it easier for removal. Okay, you okay? Okay, and then what we do is you can just go in, try to, then you just take the free elevator, pop it up, and that's the nail bed. As you can see, it's nice and healthy. And then what we do with the remaining nail plate is that we take a hemostat, which I have in my hands here, clamp it on, and just remove it. And then hemostasis, or the bleeding here, is stopped with a little bit of pressure and some gauze pads. As you can see here, her nail plate is nice and clean. No residual nail plates noted. Okay, and then we just dress it with a little bit of AAA antibiotics, some adapted gauze, and 2x2s, followed by Coban with a little bit of compression to control the bleeding. And typically, aftercare for this consists of ice and elevation every 20 minutes for the next 2 hours until the patient goes to bed. The purpose of that is to help control the pain that you have. And the pain that you should expect, it all depends on how well you as a patient tolerate pain. But typically the first 24 hours the worst. Most pain is manageable very adequately with Motrin, Advil, Tylenol. And this bandage is a little bit tight, again, to control some of the bleeding that is expected afterwards. Patients are asked to keep this bandage on until the next day, and then that's when they are instructed to take off the entire bandage and just start soaks or peroxide rinse, depending on the instructions of the physician. And there we have it, total nail avulsion.